Hi, thank you for the opportunity to apply for this role. So for the first question, I've recently developed my use of graded joint mobilization techniques for managing frozen shoulder. I applied this for a patient with significant stiffness and also pain, where I initially used lower grade mobilizations to reduce pain before progressing to higher grade techniques to improve range of movements. I've applied different directions such as some AP, PA, and also some lateral gliding and also tractions. Combined with an exercise program, this led to improvements in shoulder mobility and function, particularly with the patient's overhead activities where she was initially struggling with. Second question, so in terms of my experience in the MTT team during my placement in the neuro rehab unit in Oxford, I've worked with a patient recovering from a severe stroke with reduced mobility and also difficulty with transfers and ADLs. I collaborated closely with OTs, nurses, and doctors to support the patient's holistic approach, holistic rehabilitation in there. And my role was to assess the mobility, balance, and also functional ability of the patient, and I contributed to the goal setting weekly with the MDT, particularly around improving safe transfers and also progressive mobility. I also work closely with the OTs to ensure that our approaches were aligned for functional tasks, and this collaborative approach between us helps improve the patient's independence and also supported a safe discharge. Finally, as for why I believe I'll be a good fit for the clinic, I believe that I bring a strong foundation in the MSK, both assessments and also treatments, alongside a proactive approach to learning, as I'm currently working in a private clinic where I continue to develop my clinical reasoning and communication skills with patients. I believe that I also bring additional experiences in acupuncture and dry needling, and also some experiences from a sports setting where I've worked with a non-league football team for several months. This has helped me to become a bit more adaptable and also confident physiotherapist in different environments.